What if I told you the most powerful step toward restoring your strength as a man isn't found in a bottle, a clinic, or a prescription pad, but in a single spoonful taken at night? One small change, so simple it almost sounds foolish, yet it's helped thousands of men begin to feel blood return to places that felt silent for years. You won't hear about it on TV. You probably won't hear it from your regular doctor either. But if you've ever looked down at yourself and wondered, where did I go? You're going to want to hear this. I'm talking about the quiet return of something we often lose without realizing it: your vitality, your fire, that deep sense of aliveness that once defined you. But now, it flickers. You may not talk about it openly. Most men don't. But if you've ever laid awake at night, staring at the ceiling, wondering why your body doesn't respond the way it used to, you're not alone. Maybe it's the missing morning erection. Maybe it's the lack of drive. Or maybe it's that growing feeling of distance between you and your partner. Not because the love is gone, but because something in your body isn't showing up anymore. Now let me introduce myself properly. My name is Dr. Edward. I've spent more than 35 years as a urologist and men's health specialist right here in Greenville, South Carolina. I've helped thousands of men just like you, regain the kind of confidence and strength that many believed was gone for good. And let me tell you something I've learned after 3 decades of real conversations behind closed doors. It's not your fault. You haven't failed. You've simply never been shown how to nourish the very system your body depends on for blood flow, performance, and energy. In today's video, I'm going to share one of the most natural, safe, and effective steps I've ever given a patient. It's not complicated. It doesn't require surgery, drugs, or gadgets. Just one spoon, taken before bed. And within weeks, many of my patients have reported noticeable improvements. Not just in their erections, but in their energy, their sleep, and yes, even their mood. So do me a favor. Click the subscribe button and hit that little bell icon, because it only gets more interesting from here. And if you're watching this right now, type in the comments where you're tuning in from. I read everyone. I want to know who I'm speaking to, because this message is personal. Now let's get into it, because we need to talk about the real issue. You see, most people, including many doctors, will tell you that fading erections, low energy, and the drop in confidence are just normal signs of aging. And yes, age plays a role. Our bodies do change. Hormones shift. Recovery takes longer. That's true, but it's not the whole truth. Because what I've found over and over again is that most of these changes are not caused by age itself, but by what age does to our inner systems. It's not that your manhood is broken. It's that the plumbing has slowed down. And just like a house with old pipes, the real issue is the buildup, the things you can't see. Think about your blood vessels like tiny garden hoses. In your 20s and 30s, the pressure was strong and the flow was fast. But with time and habits and stress and diet, the inside of those hoses start to narrow. Little bits of inflammation, acidity, stiffness, they all build up quietly over decades. Until one day, the pressure isn't strong enough to get where it needs to go. That's not just happening in your legs or your heart. It's happening in the most delicate, most essential vessels of all, the ones that feed your manhood. And here's something else most men never hear. It's not just blood flow. It's the signal that tells your blood vessels to open. That signal, nitric oxide, used to fire easily in your younger years. But now, the wires are frayed. The spark doesn't catch. Your brain says yes. Your heart says yes. But your body says nothing. That's not a failure. That's not dysfunction. That's chemistry. And it can be changed. Now, here's where things get hopeful. There's a way to support that signal naturally. A way to clean those pipes. A way to bring the pressure back gently. And it starts with something as small as a spoonful, taken at the right time in the right way. That's what we're going to explore in the next part. Because one of my patients, A man who hadn't felt a full erection in over a year tried this simple step. And what happened within 3 weeks shocked even me. But I'll tell you that story in just a moment. The patient's name was Harold. He was 69 years old, recently retired from 40 years of civil engineering. Kvietman, straight back, strong handshake, but there was a heaviness in his eyes when he sat down in my office. At first, he talked about fatigue, said his energy just wasn't the same. Then he paused, looked down at the floor, and he said it. "Doc, I don't feel like a man anymore." Now, I've heard that sentence more times than I can count. And every time I hear it, I know we're no longer talking about just erections. We're talking about identity, dignity, that inner fire. Harold told me his mornings had been quiet for months. No response, no signal. He and his wife had stopped being intimate, not because they didn't love each other, but because it became too painful to try and fail. He wasn't asking for miracles. He wasn't chasing his 20s. He just wanted to feel alive again. So I ran some tests. His testosterone was slightly low, but not dangerously so. His heart was fine. His blood sugar was stable. On paper, Harold was doing okay. But I knew something else was going on, something blood work doesn't always show. I ordered a pH test, a simple urine strip test to check his internal acid-alkaline balance. And just as I suspected, Harold's pH was far too acidic. Now, here's what most doctors never explain. As we age, our bodies tend to shift toward acidity, not just in the stomach, but in the blood, the tissues, even the cellular level. That acidity acts like rust on your internal pipes. It stiffens blood vessels. It interferes with nitric oxide production, the very molecule that signals your penis to relax and fill with blood. It creates a low-level state of inflammation, tension, and dysfunction, all quietly choking your circulation from the inside out. So I told Harold something simple. Before we do anything else, let's try this. Every morning, on an empty stomach, mix half a teaspoon of baking soda into a glass of water. Add a squeeze of lemon juice if you'd like. Drink it slowly. Do that for 2 weeks. Let's see what changes. He raised an eyebrow. Baking soda? Yes, I said. It's not sexy, but it works. You see, baking soda, sodium bicarbonate, is a natural alkalizer. It helps restore a healthy pH balance in the body, reducing that internal acidity that narrows vessels and blunts your sexual response. When the body becomes more alkaline, the blood moves better. Nitric oxide lasts longer. Oxygen reaches the tissues that matter. It's like pouring warm water through a frozen pipe. Everything begins to loosen, open, and flow again. 3 weeks later, Harold walked back in my office. He looked lighter, brighter. Before I even asked, he said, "It's not like I'm 25 again, but I woke up 3 days this week and felt something I hadn't felt in a long time." He smiled, and my wife noticed too. That small shift in his body had created a ripple effect. Better circulation meant more energy. More energy meant he wanted to walk again in the evenings. Movement helped his digestion. Sleep improved. Mood lifted. And intimacy? It wasn't perfect, but it was back on the table. And that changed everything. What I love about this method is how simple it is. We're not forcing anything. We're not masking symptoms. We're removing a block. We're clearing the river so the water can flow again. Now, is baking soda right for everyone? No. Men with kidney issues, high blood pressure, or who are on sodium-restricted diets should talk to their doctor first. But for the vast majority of men, especially those over 60, this small step can be a gentle, powerful way to reawaken the system. And here's the beautiful part. It's not just about erections. Once the blood starts moving again, everything improves. Digestion, focus, warmth in the hands and feet. Even your immune system gets a boost when your body isn't fighting internal inflammation. This was just the beginning for Harold. He went on to add one more habit that truly changed the game for him, something we'll talk about in the next part. But it all started with that spoonful. One step, one quiet act of self-respect. And the results, well, they speak for themselves. What happened to Harold was just the beginning. Once the blood started flowing more freely and his energy began returning, I introduced him to something that would take his progress even further, a method that many of my patients say was the turning point in their recovery. And it all starts with an unlikely oil you've probably walked past a dozen times in the store without thinking twice. Castor oil. Now I know that might sound odd, maybe even old-fashioned. Isn't that what our grandmothers used for constipation or sore joints? Yes, it is. But it turns out, castor oil holds a secret that modern medicine is only beginning to rediscover. A secret that, when applied the right way, can help restore blood flow, soften scar tissue, awaken nerve sensitivity, and revive function in the male body, especially below the belt. Let me tell you about Robert. He was 67, retired military. No nonsense, quiet dignity. When he came to me, he was already doing everything right. He was walking daily, eating clean, taking his supplements. But something was missing. He looked at me and said, "Doc, I've got the desire, but the signal just doesn't go through. It's like the lights are off down there." That phrase stuck with me. The lights are off. I examined him, checked his labs. Again, nothing alarming. Slightly low testosterone, yes, but nothing that explained this complete lack of responsiveness. And then I asked him a different kind of question. "Robert, has anyone ever talked to you about the health of the tissue down there? Not the hormones, not the blood work, the actual skin and vessels and nerves that make up your manhood." He shook his head. "Never." That's when I explained it to him. You see, over time, especially past 60, the soft tissues of the penis and lower pelvis start to undergo silent changes. Years of micro-injuries, poor circulation, sitting too long, and inflammation can cause internal scarring, what we call fibrosis. It's not visible from the outside, but can lead to bending, shortening, loss of sensation, and poor response. The tissue loses flexibility. The nerves go quiet. Blood struggles to enter and stay. Now here's where castor oil becomes a game changer. This thick, golden oil contains a compound called ricinoleic acid, a natural anti-inflammatory that also acts as a circulatory stimulant. But more importantly, castor oil penetrates. It doesn't just sit on the skin like most oils. It travels deep into the fascia, the blood vessels, and the nerve endings. It softens hardened tissue, stimulates lymphatic drainage, and restores oxygen-rich blood flow to places that haven't lit up in years. So I gave Robert a simple protocol. Warm a small amount of castor oil, apply it to the lower abdomen, inner thighs, and gently around the base of the penis, never inside or on open skin. Use a warm compress, like a heating pad or towel, for 20 minutes after application. Do this 3 to 4 times per week, ideally before bed. And most importantly, treat it like a ritual, not a chore, but an act of healing, a message to your body that says, "I remember you, and I'm ready to bring you back online." 3 weeks later, Robert came in. I could see the difference before he even spoke. He sat taller, eyes brighter. There was a quiet pride in his voice when he said, "It's starting to work. I can feel something again. Warmth, pulsing, like I've come back into my body." He wasn't talking about just arousal. He was talking about aliveness. That's the power of tissue healing. It's not about forcing an erection. It's about restoring the conditions in which your body wants to respond again, naturally, confidently, without needing blue pills or awkward tools. Over time, Robert began waking with spontaneous erections. Not every day, but often enough that he felt capable again. He told me his wife cried the first time he initiated intimacy in months. Not because of the act itself, but because of what it meant. I'm still here. I'm still with you. Castor oil isn't a magic potion, but used consistently with care, it becomes a bridge from numbness to sensation, from frustration to hope. And when combined with the first method, baking soda to improve internal chemistry and castor oil to treat the tissue directly, it forms the foundation of something powerful. But here's the key. The results don't come from the ingredients alone. They come from your willingness to slow down, to connect, to give your body the kind of attention it hasn't received in years. In the next part, I'll share something even more surprising. It's not an oil. It's not a supplement. It's a natural substance, small, spicy, and powerful, that was used by warriors before battle to awaken blood and focus. And when used the right way, it can send a warm pulse of energy straight to your manhood in under 60 seconds. And yes, I've seen it work with my own eyes. By now, you've seen how rebalancing your internal chemistry with baking soda and restoring tissue health with castor oil can make a powerful difference. But what if I told you there's one more step, something that works like a natural ignition switch, something that can gently but firmly bring energy back to your manhood within minutes? And no, I'm still not talking about a pill. I'm talking about a spice. Tiny, humble, and older than any modern medication. It was once used by warriors to fuel their stamina before battle, and by men before intimacy to feel fire in the blood. That spice is clove. Let me tell you about Thomas. He was 71 when he came to see me. Sharp-witted, polite, the kind of man who wore a button-down shirt even to a casual appointment. He said he felt okay, not great, but not bad either, until we started talking about connection. He looked away and said, "Doc, the desire is there, but it's like my body doesn't get the message. I want to be close to my wife, but it feels like something's missing between my mind and down there." I asked him a few more questions. No pain, no major health conditions, slight decline in sensation, but nothing dramatic. But I knew the problem immediately, a failure signal. You see, every erection, every moment of male arousal starts with a messenger molecule called nitric oxide. This molecule tells your blood vessels, open up, send the blood, let it flow. Without enough nitric oxide, nothing happens. Your mind might be willing, your heart might be racing, but your blood stays still. No flow, no response. That's where clove becomes surprisingly powerful. Clove contains a compound called eugenol, a natural vasodilator. That means it helps your blood vessels relax and open up. But more importantly, eugenol stimulates the release of nitric oxide while also helping to preserve it longer in the bloodstream. And here's the key. Because clove's essential oils absorb quickly through the soft tissues in your mouth, it starts working almost immediately. Not in hours, not in days, but sometimes within minutes. So I gave Thomas a simple routine, a 60-second ritual. Nothing fancy. No prep, no pills, no pressure. Here's what I told him. Take 2 or 3 whole cloves, not powder, not oil, just the dried flower buds. Place them between your back molars and gently bite down, enough to release the oils but not crush them. Let them sit in your mouth for about 60 seconds, slowly releasing their warmth. Breathe deeply as you do this. Feel the sensation moving through your body. Then chew and swallow. Thomas was skeptical. That's it, I said. Do it daily, preferably in the morning or 30 minutes before intimacy. He called me after 5 days. His voice was different. Not excited, not giddy, but clear, certain. "Doc, something's happening. It's subtle, but it's there. I'm waking up with a pulse again. There's warmth, and not just physically. I feel more present." 2 weeks later, he came back for a follow-up. He told me that intimacy with his wife had returned, not just physically, but emotionally. He said, We held each other again. For real. Not just out of habit. That's what I want you to understand. This isn't just about erections. It's about presence. Clove works not only through the blood, but through the nervous system. It gently reawakens the pathways that have been dulled by stress, age, or disuse. And here's the science to back it up. Studies show that eugenol improves endothelial function. That's the inner lining of your blood vessels. It reduces oxidative stress. It boosts antioxidant capacity in the testes. And it even supports the enzymes responsible for natural testosterone production. All from something that costs pennies a day. Of course, like any spice, clove should be used with respect. Too much can cause irritation. If you have ulcers, bleeding issues, or are on blood thinners, talk to your doctor first. But for most men, a couple of cloves a day is safe and profoundly beneficial. And the best part? Clove works beautifully with the two earlier methods. Baking soda improves the environment for nitric oxide to thrive. Castor oil restores the tissue and blood flow channels. Clove flips the switch, triggering your body's natural response with no need for artificial stimulation. You'd be amazed how many men have used these three simple tools, each one found in your kitchen, to restore something they thought was gone forever. One of my patients, a man who hadn't been intimate in over a year, wrote me a letter after trying all three. He said, "I don't feel young, but I feel capable again, and that has changed everything." Now in the final part, I'll show you exactly how to apply these techniques the right way. We'll talk about timing, combination, and the most common mistakes to avoid. I'll also share a final patient story that brought tears to my eyes, a reminder that you're never too old to feel alive again. And trust me, if you've made it this far, you'll want to hear this. So now you've seen what's possible. 3 simple steps: baking soda, castor oil, and clove, each rooted in science, time-tested, and most importantly, real. No gimmicks, no pills, no sham, just tools your body can recognize, respond to, and rebuild with. But how do you use them together safely and effectively? Let's talk about that. Here's how I recommend applying the full protocol. Morning routine, the chemistry shift. Begin your day with a small glass of water, room temperature or slightly warm. Add half a teaspoon of baking soda, and if you like, a squeeze of fresh lemon. Drink it slowly on an empty stomach. This helps set the stage. It balances your pH, calms hidden inflammation. It improves your blood's ability to carry oxygen. Then, right after, take 2 or 3 whole cloves. Place them in your mouth, gently bite, and let the oils release. Breathe deeply. Let your body wake up. This combo, baking soda and clove, is like lighting a fire with dry wood. You're clearing the path and then sparking the signal. It may feel subtle at first, but within days, most men report a return of warmth, pulse, and energy. Evening ritual, the deep restoration. At night, just before bed, take 10 minutes for yourself. Warm a few teaspoons of castor oil, not hot, just comfortably warm. Massage gently into the lower abdomen, the inner thighs, and if appropriate, around the base of the penis. Place a warm cloth or heating pad over the area and rest. Breathe. Let your body receive. 3 to 4 nights a week is all it takes to begin unlocking blood flow that's been restricted for years. Now, a word of caution. Here's a mistake I see most often: rushing, expecting too much, too soon. One man tried the clove trick for 2 days, then said, "Doc, nothing's happening." But this isn't a switch. It's a restoration. Your body didn't shut down overnight, and it won't wake up in an hour. Be patient. Be consistent. This isn't about chasing a reaction. It's about rebuilding a foundation. And when you do, the results speak for themselves. Let me tell you about James. He was 74, widower, Kvietman. He came to see me not because he wanted intimacy, but because he wanted connection. He said, "Doc, I miss feeling like I belong in my own body." We began this same three-step protocol, slow and steady. 3 weeks in, he called me. "I woke up hard this morning," he said, "and I cried. Not because of the erection, but because I felt like myself again." That's the real gift here. Not just sexual function, but the return of dignity. The ability to look in the mirror and see a man who still has fire in him. A man who hasn't given up. A man who's not done yet. So here's what I want you to do. If you found this helpful, if something in this spoke to you, let me know. Click that like button, subscribe, and turn on the bell, because I've got more coming. And write one in the comments if you want more natural methods like these. Or just tell me where you're watching from. I read every single comment, and it helps me know how best to serve you. You're not too old. You're not too far gone. You're simply waiting to be reawakened. One breath, one choice, one spoonful at a time. And I'll be right here, walking you through it. Dr. Edward.